Hi, it's Micah, recapping my possible cerebral spinal fluid leak journey. I either have a cerebral spinal fluid leak or upper cervical instability and a cervicogenic headache. Or I have something that I've never heard of because I never heard of a cerebral spinal fluid leak until recently. So who knows? Right now, the current doctor that I'm seeing believes with 90% certainty that I have a cerebral spinal fluid leak. So I just had MRIs done and I had a CT Myelogram done. So let's recap the pain from the CT Myelogram because that was my last video. So symptoms and pain over 5 days after the myelogram. Headaches, nausea, a lot of symptoms if I got up. I had I guess I would say very minimal pain. I only needed to take ibuprofen once, and that was to sleep, I think, the first night. The first day after the myelogram, I was most uncomfortable then. I had the sciatica pain in my upper butt, lower back, pain on the right hand, the right side of my back, which is weird because they went in through the left side. I was very dizzy. My vision was extremely affected, and it continued to be affected. Day 2, less pain. I was able to get up and take a shower, remove the Band-Aid, get up, take a shower 24 hours after my procedure. Then I had a doctor appointment. I'll talk about that in a little bit. And then after the doctor appointment, when I sat up for that, I pretty much had to just go lay down. Symptoms were super bad whenever I was up. So I stayed in bed for almost 48 full hours. The third day, asked my husband to go back to work, so I needed to take care of myself. He was pretty much waiting on me hand and foot until he was gone. I overdid it. I was trying to clean and cook and take a shower, and my symptoms got so bad that I guess kind of blacked out. I threw up. I was so lightheaded and dizzy that like the black, like it started to kind of circle, darken in until I like landed on my bed, and I just could not open my eyes. I could, but it just wasn't focusing, so just laid on the bed for a little while. That relieved the symptoms. No more throwing up. No more feeling like I'm going to pass out. Just think that I overdid it. I thought that I would be better, good to go. I wasn't. So I was in bed for the rest of the day. Then the next day I took it easier. No vomiting, no dizziness. I mean, I was dizzy, ears ringing. So ever since the myelogram, I had ears ringing, increase, vision problems, accommodation, blurry vision, double vision, not being able to focus, not being able to read the subtitles or any words on the big screen TV that's literally right in front of my footboard because we moved it from the living room into the bedroom so that I could watch TV while I was recovering. So vision problems, ear ringing, dizziness, feeling lightheaded, vertigo stuff a little bit, but also seeing stuff move, like from looking at wall and refrigerator and cabinet, just slowly starts to move. Then I'll look away, it starts to move again. So had that, but by day 4, no more pain. The worst pain was at the injection site. If I took a deep breath, I could kind of feel the area that the needle went in. But after 4 days, there was no pain, even when I took a deep breath at the injection site. Then we tried to go to a store. Need to go get some dog food. About 1 hour into going to the store, I was disoriented, very bad headache, ringing ears, dizzy, feeling faint and nauseous, even dry heaving and gagging in the car when we were trying to get me back home, over the sink when we got home. I just drank water. I could not stay upright. I was like I would lean over and then I knew I was going to fall. So I just kind of went to the floor and then just lied down on the floor. Stumbling around, lying on the ground, lying on the couch. All of my symptoms improved and subsided after laying flat. So it was about 2 hours of being sick before lying down and then taking a nap in bed after about 3 hours of lying down. I didn't sleep the whole time, but just lying down and a 45-minute nap. I felt all better again. So I do believe that my symptoms are caused by positional whatever. And that happens with cervicogenic headache or upper cervical instability and cerebral spinal fluid leaks. I've been tested for POTS. I know that POTS sometimes indicates spinal fluid leak. Sometimes POTS tests don't work. I don't think it's an autonomic nervous system thing, and neither does my doctor. So that was the pain and the symptoms over the 5 days. Very mild, considering that my spinal cord area, not the spinal cord itself, got invaded. I also just wanted to talk a little bit about the myelogram. I have watched online someone that got a myelogram, and it seemed more invasive than what I had. I just had an injection of contrast into the epidural space of the spinal cord. So it was right there in the area through the ligaments, I think, through the muscle and everything. But it did not touch the spinal cord. The needle was designed not to touch the spinal cord. I had a video that I was watching of a myelogram before going into my procedure, and she was talking about how the CSF was leaking out. That didn't happen with me, and that shouldn't have happened in the procedure that I had. So I was very nervous and a little bit confused going into my myelogram. My myelogram was just one numbing injection, numb the area that didn't touch the spinal cord, and then a large spinal needle going into the epidural space, and then a catheter, or I don't know how they administer it, but I think it was a catheter of putting color contrast into the epidural space. And then I wiggled around, flip on the table, point my head down so that the color can get up toward my neck. No removing spinal fluid. And that was the thing I was most scared of. It was just dealing with the epidural space, and they used a huge x-ray machine to make sure that nothing else was breached, which I really appreciated. And it all went well. 24 hours after my injection, after my myelogram, I took a shower. I had a Zoom call with my doctor to go over the results. The results of my myelogram and MRIs, they both came back together, were a lot of things that they saw, but they didn't find the leak. My Chiari malformation, the cerebellum of my brain is still coming out too far. I think it was about 5 millimeters coming down out of the bottom of my skull. It was a little bit shorter on the left side, 4, and then 5.5 on the right side. So it's 5. And they do surgery at 5. But my doctor does not think that I have a Chiari malformation that I was born with, because I've never had headaches ever in my whole life until after my accident. He believes that there is an underlying cause of it, which would be the hypotension, so a lack of fluid in the spinal cord. And that spinal fluid keeps the brain up and high in its happy little home. And right now, my brain is sunken out. He believes that if we patch a leak, he's 90% sure there's a leak. If we patch the leak, then the brain will be back up, swimming in the happy little fluid, and it will no longer be compressing and coming down out of my skull and then there'll be more space for fluid to move through, because as of right now, the only time that I feel really good is when I lay down completely flat and almost like lift my head, like hold my head up. We didn't find the leak. We see all of the other issues of the hypotension, if that is what I have. The cerebellum tonsils or the cerebellum coming down too low. A couple of different positional postural issues and minor disc issues that would not be causing all of my symptoms. Myelogram and the MRI results showed that brain is sinking down, coming out of the bottom of the skull, but we couldn't find the leak. My doctor, after going over the images with me in the appointment, there might have been a spot in the neck, which would make sense because a lot of my pain comes from my neck. A lot of my irritation and twitches come from my neck position, but that also could be happening with cervical instability. So I feel better when I lie down. I feel worse when I stand up, feel very much worse if I'm moving or turning or spinning or riding in a vehicle. He is referring me for a blood patch. The non-targeted blood patch, as I understand it, is where they take blood out of my arm. They will take a substantial amount of blood. I don't know if they do anything to it or they just inject it right back in, but they take the blood, my own blood, from me, and then I will be back laying face down on the myelogram table like I did for my procedure. However, this time they will be injecting my own blood into the epidural space. I've seen lots of images and heard that they do it in multiple areas, so multiple injections along the spinal cord. I don't know. I've also heard that they can just do it in one space in the lumbar area. They will inject as much blood as I physically can allow them to. I will be the one to tell them to stop. That's nerve-wracking because as someone with clinical anxiety, how am I supposed to know when you're going to stop? Pain is at a 6 or 7. It's apparently when I give the stop button. That seems very subjective to me. Anyway, they will be injecting as much blood as I can take into my epidural space, and then the blood will hopefully travel. I will be laying flat after this. The blood will hopefully travel toward the area where the spinal fluid is leaking, and it will patch the hole with my blood because our body is amazing, and that's what they do. Your blood cells go and they fix things. So that is what a non-targeted blood patch is. Get injected, blood travels, and you stay flat for a very, very long time, perfectly flat, ideally, so that you're not preventing the blood from traveling, especially if my issue is in my neck. If the blood has to go all the way from my lumbar spine up to my neck, that's going to be a lot harder. There's other ways to get it just up to the neck in the case that this blood patch doesn't work and I have to go through another one. There's a way that they could just do it in the neck. There's also targeted blood patches that they specifically go in and just shoot it in whatever area you have a leak. However, we didn't find a definitive location site of my leak, so we don't have a place to target, hence why I have to do a non-targeted blood patch. So I will just be taking however many milliliters of my own blood as possible, and the surgeon, the doctor, will be injecting it into my spine. Hopefully it fixes itself, and then I feel all better. After the epidural blood patch surgery, I cannot lift or bend or cough or sneeze for 6 whole weeks. Can't go anywhere. It's very limited. I will be laying down on my back for as long as I can stand it, a minimum of 24 hours, and then I'll be hanging out at home, hopefully feeling a lot better. I think that's it for this update. Thank you for watching. Bye.